This conference will now be
Thank God
recorded.
it's a lot of nights.
Yeah, no kidding. No kidding.
Yeah.
And do you still do lake trout,
Yeah.
January? What lake do you go?
It all depends. Usually Snowbank.
Okay.
We will do Burnside or Bass. The 1 year we went tonight, we walked up tonight. 2 years ago, 16 miles. Sure. Believe me, I didn't know how much fish. We caught a lot of fish. We did, yeah. We got a lot of fish. We went up to the state on to get portage. We went into nice fish.
We're planning for 2019.
Really? We got 17.
Yeah. Oh my.
My mind is.
They were playing that everything. I lost bait. I mean, I know the fish is all bait, but I also know. And then we caught.
Yeah. We ended up catching the space study, right? Yep.
But you know, it's all going to be
26 trout.
Wow. We're all designing. So we could.
You were the one that told me that January was the best time for acres.
Oh yeah, it is
So
January.
I'm like, I
haven't done it yet. I got to do it.
Oh yeah, there is a.
And you know,
Sure, yeah. Yeah.
You can be on.
Oh, for sure.
Right?
Sure, yeah.
Okay.
That's the benefit of the free
A lot of
ball
times
product.
it's nothing.
Yeah, no, that's
Once
true.
with
our new remodel that we're doing too, with our building.
Yeah, it's a hit or miss kind of.
It is. You've been to the North Shop, free ball has, they're moving balls. They feel permanently.
Definitely, I love it.
Yeah.
Because we'll go past the line.
He had a good time up there, you know, I didn't realize that he had a contract with HVAC. So Greg Wood and him were talking shop, they were all, they were having Yeah, great.
Okay.
It's gonna be good.
Okay, we'll go ahead and get started.
Maybe it is. Oh, really? Okay.
Well, thanks everyone for coming. This whole thing was born out of, Tom Atkins had some ideas about needing a texting solution for his department and joined with IT to say maybe this should be more of an enterprise solution. We have other needs for this solution. So before we dove in and picked a product or did anything like that, we wanted to make sure that we had everybody's eyes on this and receive feedback from you both in, is this a product that would work for your organization? Are you interested in it? And also, you know, have the opportunity to ask questions of the vendor for the product. So with that, I'm going to hand the floor over to Mark so that he can tell a little bit about himself and the company and the product.
Thank you. For those of you who don't know me, I'm Mark Coopy. I'm the former CEO of Canvas Health. And while I was at Canvas Health, we wanted to try to do something with suicide prevention that was different and was having more of an impact than what was going on in the state. And I hooked up with EMS, Educational Messaging Services, out of California. Tom Evans, the CEO, and I started having conversations, and we built a Text for Life program for the state of Minnesota, which was a suicide prevention program. The texting platform was so impressive at the time for me, and so flexible and dynamic, and worked so well for the service that we were doing, after I retired from Canvas, decided I wanted to continue doing some things with them, and so I'm still active with them, looking at ways that we can promote this, in particular using it in other areas of the human services in which texting might be a much better format for connecting with both clients and internally. And so with that, I'm going to turn it over to Tom Evans, who is the CEO in lovely sunny California, unless it's raining there now. Tom, are you still there? Well, did he get?
Not yet.
Oh,
There he is.
that sounds like you, Jonathan. Is that you?
No, it's Tom. Can you hear me?
Oh, there it is. Okay, now I can hear you. Yes. Looks like we lost you for a second. All right, go ahead.
It's not raining yet. We're hoping to get some rain this afternoon, though, and then maybe a couple of days of it. We could sure use it.
Yeah.
I'm here with Jonathan Holly, who's the Chief Operations Officer of the company, and going to, show you some,
You're breaking up. Are one of you on a cell phone? Something's breaking up.
Okay, let's try. Is this better?
There, that's what you had this morning. That's where you are now. Perfect.
Okay, you can hear it now. Okay.
Yes.
Well, we're going to have to start over. Thank you, Mark, for the introduction. I'm here with Jonathan Hawley, who's the Chief Operating Officer of the company, and between us, we're going to show you some really wonderful applications for text messaging, consistent with the findings that we're seeing from pretty good sources. We are a company that is 100% dedicated to health and human service, have been doing that since 1994. And so we really believe in implementation, but implementation with rigorous evaluation. And so we'd like to start with the citations from a couple of agencies, one at the American Journal of Preventive Medicine, and then from the NIH, both attesting to the efficacy and some of the behavior change you can expect with SMS programs. As put up on the screen, can everybody see that okay?
Yep, it looks good.
Good. Well, according to American Journal, they can produce positive change in preventive health behaviors. And this is also buttressed up by the fact that those changes stay in evidence after the intervention stops, according to their findings. As it relates to National Institutes of Health, they have looked at a body of evidence now that is taken from thousands of programs, as they say, throughout the United States, and that it is showing the same thing, that text messaging-based programs on mobile phones can modify people's health behaviors. Most of the programs that they've looked at consisted of both automated and interactive, or what we call two-way live texting. And we're going to show you both of those modalities today, along with text message programs that kind of seamlessly link you to web content. Those three kinds of programs really are the ones that have been cited by them to be very favorably evaluated to reach the aims that they set forth with. So we'll go on to the next slide. In Minnesota, just at the present time, we are currently working with the 211 there in Greater Twin Cities. We're working with the St. Louis County Health Department. One of those program slides will be about them. We're working with the Minnesota Department of Human Service. We have a slide about them as well. Minnesota AIDS Project, the University of Minnesota, Mental Health Minnesota, Canvas Health, of course, as Mark said, Police Department there, and actually Southern Prairie Community Care didn't make the list, but we're currently working with them as well. So we've got a pretty good footprint in Minnesota. And Mark, if you wanted to elaborate any on that?
No, the most recent thing that we completed, though, which you'll see at the end, is through the Minnesota Department of Human Services doing the gambling helpline that we set up with them, and it's another one of the samples that we got. So I think that's all I need to say, Tom.
Good. Well, we were pleased to just recently to get a request to go into service or submit for a contract for service with Dakota County. So we're going to, like I said, give examples today of text capacity that are the two-way kind of texting for live exchanges, where, you know, things like case management, referrals and information can be given, descriptions of agencies can be given. People are texting now more than they're using phones. There's a couple of statistics about that are coming up. Helplines, of course, use it in a two-way capacity. We're also going to show you today some automated texting with data integration. In essence, texting programs that are automated and can reach into databases and pull out information that is associated to the encounter as people request things and or ask questions and answer questions. Very wonderful work being done in Minnesota that demonstrates that. At the end of this presentation, we'll show you that. We'd like to take a little bit of time and show you how text surveys work, how they can help with intakes, and they can actually run adaptive surveys to help determine eligibility for benefits and for services, and we have a couple of examples of that. And then we'd like to take a little bit of time and show you how messaging can work with groups of people that can be one-off messages, things like updates or information, news, things of that nature, or messages that span a length of time that continually make contact with people as time goes by, and as we have done with numerous WIC programs across the United States, help people and families stay in touch with information that's consistent with their eligibility, their benefits, and some of the nutritional guidelines that promote healthy behaviors. These kinds of things are all going to be demonstrated in the slides that we have, and some of the ways in which to use the interface, which you will see. Go to the next slide. WIC programs, as I mentioned, throughout the United States have been using this platform for, going on probably 4 years, maybe 5 years now. In the main, we're summarizing, they're getting big improvements in enrollment. People are staying enrolled by virtue of making their appointments and keeping up on their information and contacts with WIC case managers. The behaviors that have changed, that have been noticed and studied, are that families have chosen to breastfeed more often than not when they're in these text groups as opposed to control groups. They both initiate and stay with breastfeeding longer by virtue of some of the support that they get from the text messaging program. As I said before, there's less missed appointments, and the overall satisfaction is quite high with participants, simply because none of them really use their cell phones to call anymore. But they all use their cell phones to text. And we got some statistics on that as we go further through the program. Let's go to the next slide. We're going to do a demonstration now with you guys that allows you to participate and just see how easy this user interface is to use. Jonathan Hawley is going to take it over from here and show you that, but the text demo to 85511 is how you would participate with your own cell phone. And if you just address a message to the short code 85511, where you would normally put in a phone number, and then send the word demo. It can be all caps or it can be lowercase. That will do what's called opt you into the program. And I'll let Jonathan take over from here.
All right. Hi, this is Jonathan. Everybody can hear me, right? My audio's okay?
Yeah.
Sounds good.
Good. So what you see there, guys, is the young lady who is interfacing with clients. So she's using that the website, and she's going to the website, secure environment, SSL, and working at a computer workstation. But she could be going to the website from a tablet. She could even be going to the website from her mobile phone if she's got browsing capacity. So it's a web-based software that sends text messages to the participant or the client's mobile phone. The mobile phone is what the client is using, the end user, and then the staff member is logged in and texted in using the application. And that's what we're going to jump onto right now. When I jump away from this, when I jump away from here, a second here, oops. Okay, I'm going to jump away from here, and then I'll jump online in just a moment here. So I'm going to pull up the user interface that you saw in that screenshot there, or that image. So this would be where staff log in, and everybody has their own discrete login, just like any web-based service that you use. So for instance, if you log into Netflix, you know that you've got an email and a password, or your username and password. Facebook, anything that's online that has login credentials is going to be consistent with this. We have a elevated security component to our website, the URL address, as well as the way we're storing and archiving all of the data. So what you'll find with PreventionPays and the text platform is that it is on co-located servers and data centers, so dedicated servers and data centers that are thumbprint access only, and storing and archiving data according to and beyond HIPAA guidelines. When we log in, we use our email and we use our password, and we come to the page in which we view, right? I've got a little staff chat log here that I can hide or show, but here I want you to focus on this. This is the queue, and this queue is where all your numbers appear, because you all texted demo to 85511. And so you can see clearly here that these phone numbers are all opted in, the opt-in keyword demo. And then the blinking ones are the ones, and you'll see each one blinks periodically. They're the ones that are actively getting messages, right? So you get a series of messages. Now, we created the series in advance. So if we go over here to the reminders tab, this is where we can look at that series of messages that you're getting. If I edit this one right here, this is like building blocks. If you're familiar with how you put together Legos and you build upwards, and in this case we're building downwards, but we're starting with the parent message, the first one, and then we're building off of those. And the 2886 leads to the 2887, leads to the 2888. And so you can create a sequence of messages according to any timeline, according to any schedule, and that can be consistent across all your clients. So everybody gets the same sequence of messages. And then, of course, you can edit them and look at them and change them or do what you need to do, all under the same dashboard. And you go back over here to the Users tab, and this is where you actually see the phone numbers and all of that messages. I sped it up. Normally you get like one of these messages a week, or maybe, one every other week. In the beginning, some of the WIC agencies, how they start is they'll stagger them maybe once every couple weeks, and then as they get closer to delivery, they'll do once or twice a week. And that seems to really be consistent with how that audience wants to receive that information. And then at any point in time, I can pop open these cases. But before I pop open these cases, if you look here, when you scroll over one of these outgoing messages that we set up to go out automatically, each one of these outgoing messages has a delivery receipt from the carrier. It's known as carrier-grade message delivery tracking. So when we set up these numbers, they're set up to do texting, and they're set up to be health and human services, so the carriers know the kind of messages that are going to be going down the numbers and through the channel. And then also they're set up to support delivery receipts. So that means that, let's say I have Sprint, for example. When Sprint delivers that message, they notify our application, and we notify you. So when you scroll over the timestamp, you actually see that's a carrier letting us know that first we acknowledge it. That's that ACKED Act. We acknowledge receipt of it, And then that second item that happens very shortly afterwards is delivered. And that happens rapidly, right? Acknowledge delivered, but each outgoing message has that characteristic, which is important, particularly for health and human services. You never know when somebody might ring you up or come into your office or whatever and say, I was supposed to get a text message from you and I didn't. And now look what happened. I didn't get to complete my application and now I don't get the benefits, or I don't get this, or I don't get, how come you didn't text me? Well, what's your mobile number? You can search up their mobile number by name or mobile number, and then you pull open their number and you go, well, actually your carrier notified us that they delivered this message on such and such date. Oh, you see, so then it's about not necessarily about whether or not the message got delivered. It's about whether or not you have the right mobile number for that client. It's a different, a totally different discussion. So we think that's a very important and critical part of the overall application is these delivery receipts. It's a very important part. Now, when I pop these cases open and I want to have conversations with them, I just click this open button and I can open as many cases. I can also sort this and look at the top 5, or I can look at the top 3, or I can also look at what's new, right? If I just want to look at all cases, not all cases in the queue, right? I can look at just the new cases, the ones that have opted in the last 5 minutes or so for this demo. And then I can pop open each one of those cases. And as I pop them open, they'll come out of my new column because they're not new anymore. Kind of like answering the phone. When you answer the phone, it stops ringing. Or when we answer one of these texts or open one of these texts, it's no longer new. So we'll go ahead and open these up. And when I open these up, I have an attribute tied to my primary case, which runs right down the middle. This is the one I'm texting with. Then, if I hide this, as I open up additional cases, they will become my background cases. So if I have my screen widened here, I can actually see as many as I open up, or probably not all of them, but I am going to open them all up just for the purposes of a demonstration that I'll show you in a moment about group texting. So I'll open all of these up, and then what we'll see here is my primary case and then my background cases, right? The cases that I'm monitoring. And these cases all update with inbound messages from the client, as well as any outbound messages that I send, so that I can be monitoring concurrent conversations, which is really neat. When you're doing casework, reaching out to maybe 5 or 6 people all in one fell swoop, and then monitoring their responses all at one time can be a pretty nifty thing, because you've suddenly taken what would take maybe quite a bit of time and maybe not very successful, because you're trying to leave voicemails, and you know, with some younger people, they don't even set voicemail up. And so you get maybe the voicemail you're trying to reach is full, or you get this voicemail has not been activated or something like that, right? Because you're trying to leave a message to somebody that doesn't really do very much voice calls. And so here, what we're doing is we're sending out a text message which has a 95% read rate in the first 5 minutes. So a profoundly different success rate on that. Emails are opened at 20% if you're lucky, right? When you send out a group email, you're lucky if you hit the 20% mark. Twitter is read at 20%, so we look at approximately 20% of the tweets that go through our Twitter feed. So there really isn't much that even comes close to text. Text just is king in that regard. And then I can also, which is really cool, I can open up all these cases, and I can pop over here to Groups tab, and I can say, here are cases I own, 10, because I opened up 10 cases. I can say, cases I own, hi. This. Right? So I send that out, and I'm going to send that out to all cases that I am open on right now. So this group message, it'll tell me up here, group message created successfully. If I don't put any future date and time in there, it's just going to go out the moment I generate it. It'll go out to those 10 clients, and then when those 10 clients respond, they don't see their responses, each other's responses, just you do, right? Your staff member or whoever created that group message. So then when I pop over here to the users tab, we'll see that it's intermingled with those automated messages that we're still sending. But you can see in each one of these profiles here, and you see it on your phone, that I sent out that message. Hi, this is Jonathan. How may I help you, right? So, and then what's really cool is what we're seeing, like if you guys want to reply, you can reply and you can see your replies in a live way, which is really fascinating. It changes the sort of the whole communication paradigm in that way, because you can handle volume in a way that really becomes miraculous. It adjusts to the level of proficiency you have with the application. And then, so as I reply and as I get replies back, I can monitor, and then I can look at this one, and I can say, view that one. I need a caseworker, right? I need a new caseworker. So I can reply, sure, right? I can use a canned phrase if I want, or I can do a handwritten one. Sure. What's your case number ID, right? Something like that, right? And so then, boom, I'm in conversation mode with I need a caseworker. Meanwhile, I look over here and I say, oh, okay, they replied. So then I can go, okay, now I'll go over here and I'll talk with them, right? So that I'm just checking off which ones reply and handling them as I need to. Now, of course, there's a learning curve. As with any software, as with any communication tool, there's a learning curve. And that's what we're all about. We really work hard at the educational portion of the process, so that everybody knows their role, and that there's online web-based training that's kind of like this because we're remote, and but we get right in there and we train to the skill set, right? We train to how you're going to be using the application, rather than having this giant training on all facets of the application. More specialized training on, well, this is how I'm going to use it. And so then, therefore, my training is going to be consistent with my use. So that's kind of in a nutshell, guys, what we wanted to show you as far as like jumping between conversational texting and group texting. Pretty easy stuff. And then educational text, like Tom had talked about in the beginning. All these things can be coordinated in advance, preloaded, and set. And then what's ad-libbed, of course, is the day-to-day communications, if you so choose to do that. Now, you can operate as a one-way service, right? You can send educational messages and have automated messages that go back to responses. You have those settings as well. But you're always going to see, if they do reply to your automated messages, you're always going to be able to see and view their responses. So that's all very transparent and available, which is important. Because even if you're not operating as a two-way, people, their knee-jerk reaction to texting is it is a two-way street. They just they think it's almost the expectation that it is. And so as a result, we provide you with the total transparency of all of that feedback that comes in. And then you decide what you're going to do with it.
Now, what you've seen here today on this one demonstration.
Is your audio on?
What you've seen here today on this one demonstration is suited for WIC uses, preliminary WIC uses. There's many more that we won't have time to go into today. But to just double down on the point Jonathan made, we train specific to how you'd use it. So if you were using this for WIC, there'd be a training specific to that. If you were using it for other uses, there would be a training specific to that. So if we can go back to that slide, show.
I'm going to add one thing here, Tom, just while we're talking about that. From a training and support standpoint, we were operating a 24/7 crisis line, and they were fantastic. So they were always available to us. The conversations in the training are simple and easy. We had people being trained within an hour or two and actively working. We'd be able to go back and call them, talk to them to do things. So you get that kind of support with their system, and they're able to do this relatively easily and smoothly with it. So go ahead, Tom.
Well, now what we'd like to do is move away from the actual hands-on into some more program examples, just to help kind of broaden out this perspective a little bit. In the state of Vermont and in the state of Indiana, we're currently using the system to help with SNAP assessment, intake, presumptive eligibility determination, and enrollment in line with federal guidelines that then are work directly into the system. So people opt into this by sending that keyword, like you sent the word demo. There's a keyword for the SNAP survey. You take the SNAP survey, you're going to have your presumptive eligibility determined. You'll be given a link to the nearest enrollment location to fill your application, complete your application. And as that relates to the requirements that are set forth by the USDA, that meets the reimbursement standards. So that with a text-based program like a SNAP assessment and survey and enrollment tool, the outcomes from both those states are that it cut staff time, that automation was such that it was going to increase SNAP enrollment as they're reporting. Of course, it met the objectives of the state and local government, and it provided consistent service delivery in line with the SNAP goals. Now, the reason we've abbreviated this slide a little bit is because there are various requirements we understand for SNAP in different places. So if we can move to the next one. In St. Louis County, we have another tool, another texting program that associates people to an assessment, an intake, and it's in line with finding shelters and services subsequent to being placed in shelters. It is something that St. Louis County is expanding and is, I think, in the process of taking into one of its adjacent counties. And it's simple as well. If someone was to text the word homeless to 85511, they'd be walked through this that linked them to an assessment and ultimately to a case manager that would help them with their needs in the moment. If you can move to the next one. As far as demonstrating a survey and intake, I think we'll come back to this slide if we have time, but I'd like to move now into an area that has shown terrific results. And as those two citations talked about at the beginning of the presentation, when you create text groups, when you're sending out sequenced messages to people, be they one-off or be they over time, what is shown in study after study is that the people in the applied group are outperforming people in the control groups. In this particular early study done back in 2015, we saw that just general information being sent to folks, not information that was anywhere near PHI, but just general information being sent to folks, helped them with some very critical markers, as you can see. People attribute text group involvement to helping them reach their goals, and they're satisfied with that. If you could move to the next slide. Another issue-specific with supportive message program was done for women in Wisconsin, all about heart health. If you move to the next slide. Today, what we're finding, though, is people can actually have needs well beyond just in the moment. And so with a financial literacy program, in Orlando, we built a service that kept people in the know about all their financial concerns and things that they could do as it relates to all of the variables that you see here. And the reason we put this calendar up was to show you that text messages can be preset to go out to people, determined by their demographic profile, their socioeconomic, the issues that they're interested in, and even how they answer adaptive intake assessments that can trigger messages out over a year. In some programs, children 0 to 4, they go out over 4 years. In access to education programs, they go out over 4 and 5 years. And so texting has come a long way since that one program that we showed you in 2015. They span the width and breadth of people's involvement with issues and things now over a long period of time. Go to the next slide. Ex-offenders is another example, and in a program out in California, we see that having people in a text group helps with them lowering the number of times that they violate probation. A great program that's been done out here in California. So just another example of how texting can be used to communicate with specific populations. Go to the next slide. You saw how group messaging was used. Jonathan, I think, sent you all back a message pretty instantaneously. Group messaging is really a wonderful feature when it comes to a variety of program uses, such as the work that's going on at Southern Prairie Community Care. And Mark, I think you wanted to elaborate a little bit here.
Well, the one thing that we notice when we make the presentations is a lot of people are thinking about group messaging with clients and constituents that they're working with. I want to remind people that this is also an absolutely wonderful tool to use internally. So managing teams, operating things within the process is good. We had a conversation with Public Works this morning about that. HR is another area in which sending out notices and requests for information or health-related events that are going on for employees. All of those kinds of things are all easily able to be managed through the group messaging process. They don't have to be two-way. They can all be one-way, so they can all just be automated and sent as reminders and support messages through a lot of that. I know Canvas Health right now is starting to use the texting process in their care programs for sending out support messages and reminder messages to the clients to help them to keep going and to keep connected with that. I think that's it, Tom. Go ahead.
Right. The idea is that we can tailor-make groups of people for you to send messages to by any kind of variable or marker that you can think of, and they can also be made by the way people answer surveys automatically by the system. So it's a real handy capability for you to have, and certainly can be used in a wide variety of ways. I want to go to the next slide. This is another example of a program that was done just there in Ohio when, people think of text, they think of getting a message. I think you probably all have gotten texts with embedded links in them. We use embedded links a lot with our programs. In this example, all someone had to do was see a bit of collateral in the community if they were interested in getting information about where their immunization neighborhood clinic was. All they had to do was send RCFLU, RC standing for Richland County, the 898-211 to the short code. That was a very, very quick and easy utilization of the service, because what we saw right away is that browsing on mobile devices has now overtaken browsing on laptops. And in fact, recent studies, 2018, report that up to 80% of all browsing is happening on a mobile device. The use of embedded links in text get people directly to where you want them to go, to content that you want them to see, and where they're most likely to view it. And studies on that are just coming out all the time in showing the efficacy of combining web pages with texting so as to get people directly to where you need them to be in an easy and very efficient manner. Want to go to the next slide, John? Another example of a program that's a federal program, Text for Tots, you might have heard of it. This is a way that you can help families with nutrition and activities, with local resources, with healthy habits and things of that nature. A highly effective program that, if you go to the next slide, really does support outcomes like healthier parenting, better family nutrition, more children hitting age-appropriate stages, more children receiving appropriate early interventions and or starting preschool early. This is a program that stays in touch with parents and guardians for up to 4 years. And the program is loaded with content and richness to be able to take advantage of. Now, we're a clearinghouse of programs such as this, but I got to stop right here for a minute and say we're building programs to meet the specific needs of health departments and sites right on across the United States that are custom built to behave exactly the way you need them to. So we would like nothing more than to be able to build a couple of demo programs for you if you have an interest there, just to demonstrate the flexibility of the platform and how it might be used. Go to that next slide. One of our biggest programs currently is in the fight against the opioid use in the United States, the opioid epidemic. In association with the United Way, we've built a very robust automated text program with a live response component in it as well. So here's where we're combining automation with live responders. And this program has been now rolled out in 14 states and has gotten some terrific early and initial results. Getting people to service, following the guidelines of the National Institutes of Health and addressing the barriers to service, promoting prevention, doing the things that NIH really wants to see happen in community after community. This program leverages the texting platform in a great way because as texters text in, and you're going to see an example of this with the Minnesota program in a moment, they text in the keyword, they're walked through a survey. That survey drills down to a specific need that someone might want, be they a person who's using opioids or someone who's concerned about others that are, or just general information that they may want, or even professionals that are looking for some best practice guidelines. This program will do that, and at the end, when you enter your zip code, it will look into the national database and it will pull out those specific referrals called a proximity search that are immediately around you. So it really uses a lot of intelligence to get to an easy way to deliver information to somebody who really needs it. If you switch to the next slide, Jonathan, because I think we're going to be short on time. As I said at the beginning, we are implementation-oriented, but we are evaluation-oriented. And we really believe that you almost have to start with evaluation first. We've got to be able to visualize our data. We've got to be able to report on our data. We've got to be able to download our data easily and give it to you guys in an easy format to manipulate. So not only do we have dashboards that help you visually look at it, but we also have ways for you to automatically get your reports out of the service on demand through setting up the reports, of which there are 20 to 25 pre-made ones, or we can give you complete data dumps through what's called an FTTPS file transfer protocol that you can manipulate the data in ways that you want. And without going into a lot of that in this presentation, suffice to say that data is something that we really do have quite a handle on, and ready to share more information with you in a different maybe setting where we can take you through some of that. Go to the next slide. This is that program that does that proximity searching. I mean, and this is a Minnesota program. This is a program that has to do with problem gambling. So if you're in a casino or in an area where there is collateral or visiting a website even, this program is such that it will allow you to simply text the word HOPE to 61222. Now that's something you guys can all do if you care to. You can text the word HOPE to 61222. What that'll do is that will query you for your zip code, and when it queries you for your zip code, what's going to happen is you're going to get, by virtue of the zip code you put in, it has to be a Minnesota zip code, by the way, because that's how we've set this program up. It'll give you back resources that are immediately around you. And it's been a very good program now that's been running for a little while there in Minnesota, and uses that kind of automation and integration, if you will. So if you care to do that, that'd be great. It's something that is emblematic of some of the good uses of the text program. If we can go to the next slide. Our agency is, like I said, dedicated to health and human service. We are your contacts for anything that you need. Mark is, and I think with the few minutes that we have left, if there are questions, we'd like to answer some.
All this can be viewed over a computer, and can a caseworker view this through an app on their phone, or I guess that covered it.
Yeah, it's a web-based program, so you can log into the program from an iPad, from your phone, computer at home, wherever it is, but it is a web-based system, so when you log into that, whatever device you're doing, it will accept that device, as long as it has the browser ability to go to the website. And then you'll be able to enter your email and your password, and you'll be able to see your system.
Every division, every department, every program there that might be involved in this will have its separate inbox, so that when you log in, you won't be seeing any of the other people's or other divisions or other program work. It'll be siloed in a way to where you're just seeing the program work that you're involved with. Everything is set up, all those configurations, all the push programs, the live communication is all done from the web interface or the web page that you log into. And with a couple of hours of training, you'll be able to understand how to use the service in ways that'll meet the needs that you have, be they program-specific needs or open two-way texting or combinations of both, or looking up data in databases and using it to do whatever it is that the program warrants. We make it available to you exactly the way you want that behavior to be.
You can also set it up within your system. So if you have several probation officers under you that are, let's say, doing case management, and you have a supervisor, the supervisor can see all of their text and everything that's happening with that system too. So you can create those layers of viewing and observation and stuff to do that, or for someone to be able to cover those kinds of things.
How do we, so it's in the interface, how do we capture that data too, as how we're communicating with clients to make sure the database does record stuff?
Right.
Record retention, how does that work?
You want to talk a little bit more about the records and the recording and the data as you're compiling it, Tom?
Sure. Jonathan touched on that at the beginning. We are a HIPAA compliant SOC2 data center, which means that we comply with all of the criteria that we need for adequately holding and protecting records. The record retentions the record retention is done in compliance with that. And as such, we've got a couple of white papers that go through the monitoring protocols, all of the system software and hardware that's involved in that, and would be happy to share that with you at any time. Record retention is a big issue for us as it relates to the kinds of program work that we do, so that it's all done in compliance with those two criteria, HIPAA and SOC2.
You can also set up reporting systems for how you want to collect your data that you're doing that. All of those records of your conversations are kept. So each time, let's say you have a client that you're talking with the third or fourth time, the fourth time that you've hooked up with them on the system, it will show all the previous conversations you've had with them. So you always have that record. You can also copy and paste and put that into a file in your system if you want. They can look at integration into systems, but I already know county systems are extremely difficult to integrate with. But you at least have that option for doing something like a case record if you want to keep track of that. But the reporting is constant, it's virtual, it's on demand. So as you're going along with it, you can look into that at any time. You'll know how many people are texting, you'll know whatever it is you've set up to record that at any point. And then you can create automatic times for that report to be dumped into your system or set up for you to pull that you want to look at, and all of those can be automated too.
So those reports are already built?
Some are built now that are standard reports they've got that you can look at, but you can also design some reports based on the content that's in there that they'll help you develop that might need to look different for what your purposes are.
And I heard him say we can pull the data out too, and pull the data down into our system.
Yes, you can have that downloaded into your system. It's a matter of them being able to create the handshake with your system and doing that.
So this may have been covered before I got in, I apologize, but can you talk a little bit about your redaction capabilities? Because we do often get data practices requests that we have to provide the information publicly, but there may be names or particular words that can't be shared publicly.
Did you hear that, Tom?
I couldn't hear that. I'm so sorry.
So the question has to do with redaction capabilities. So sometimes, there might be a situation they need to publicize, let's say, a conversation, but they need names redacted. What's the ability for redaction purposes on doing something with that?
Well, the system is voluntarily able to collect names, but they have to be entered. That's first. And then they become associated to the case. Typical, though, for us with redaction is to redact the cell phone number, and the system has a built-in feature that allows that to happen. So that's the unique identifier in the SMS dialogue that normally gets redacted. The idea that you can do that is important to us, and it's something that the system allows. So if that's the width and breadth of the question, that makes sense?
And then, yeah, the other part of it is that within the system, the attributes area, you may have a telephone number, but that's in the attributes part of the programming. It may have the name, it may have the address, it may have that they're on economic assistance, it may have all of that, but that remains private. So that's never part of the conversation that you might see publicly. So if what you were trying to do is produce or reproduce a conversation to show someone, no, this is exactly what was said, the telephone number would be redacted, but none of that other information about who that was or any of that would have to go forward.
I think, Molly, what you're asking for is something we would probably have to do some custom, where we would do a data search, so we'd pull all that information together, but in the report that we send out, we would redact the information that doesn't go out. And it'd have to be a custom report that we set up, so that it doesn't, so that we have that option to redact what needs to be redacted.
Again,
I got part of that question.
Yeah, the attribute section can be part of your reporting system, and whether you show that or don't show that, it's up to you. I was referring more to if you're not going to change the text, you want to see that, what you can easily deduct when you set up the telephone number, so that nobody can track back through that conversation.
Question about, so I know you can embed a link to something else, but what about a third-party app? So specifically, I'm thinking about the 2Gen stuff at the university with the application. There's a few counties that are rolled out regarding their eligibility for TANF benefits, right? So is there the ability to embed your program within an application platform? Just thinking that might even add a lot of value to it, or would that have to be something built from the ground up?
Did you hear that one, Tom?
Well, I think I did. I think, and it's an interesting question. So if I got it right, it would be great to be able to initially engage people with a text message that then channeled them into an application, right? Is that would be the goal, right?
Yes.
Okay. The application will no doubt have to be downloaded onto the mobile device, and so where the text message might come in handy in that regard would be to take them to that exact download site where they could get that application on their mobile device. The text message could also follow up with them over time once that application was on their phone to inquire as to, were they successful? Did they need the link again? Were they able to complete the application? Were they satisfied? I mean, texting can be wrapped all around that over-the-top kind of application where you have to have that on your phone, and once it's been downloaded, you can use it to communicate. But yeah, texting can play a very vital role there.
Well, just thinking of the response rate, how to roll this application out, the engagement will take extra effort, but if they're responding at 85%, I mean, that just seems like an easier way to enroll people or get their attention about it. So.
Yeah, one of the examples that Tom started to talk about was our work with Southern Prairie Healthcare System. Their concern was that their case manager was getting the Medicaid dump every month, maybe 500 clients, new clients each month that they then had to reach out and contact, get them into the system. She was calling 100 times a day, 100 phone calls a day, and people weren't responding or answering. So we set them up on the text, and just doing a really quick front-end rollout to do it very limited, we only sent out 30 numbers. And so she uploaded the numbers from the Medicaid system into this system, clicked the messages that were pre-canned and set, welcome to Southern Prairie, that and go through that whole process. And they went out. So 30 messages went out, and within 10 minutes, she'd already gotten 3 responses. We were disappointed. We were thinking, oh, God, we were hoping for like 50% or something like that. She was elated because it would take her all day to get 3 responses with 100 phone calls. So so they have expanded and continued that system. You're absolutely right. People will engage this process and do something differently, they will, than trying to do it on the phone or sending something in the mail or whatever it is. This is a link to those kinds of things. We did have a conversation for a little bit this morning too, because the question came up based on SNAP and TANF, and that your process here is that there's a dual process that you usually are doing when you're evaluating that, of trying to figure out whether or not these systems can be stacked and done together and that. So we have some more conversation on that, and George Stone had left me a note wanting to talk further about what could happen with those kinds of things. Other questions?
I want to know if Wayne's going to be able to keep me up to date on that Woodbury Drive project when it goes into something like this. So I know whether to turn left or right on that thing.
I'll give you driving directions.
Right, there you go.
Can you text pictures? You can text pictures?
Well, I know you can. I want to know if you can text pictures in terms of the system. Can you do pictures on it? We talked about applications and other attachments, but I don't know about pictures. What about pictures, Tom?
Well, yeah, that's a different service, and it's enabled on the platform. And what it's called MMS instead of SMS. And pictures and videos and forms and all those things are able to be sent.
Optionally, you have to activate it.
You have to go into the
It's
other.
not something that is available out of the box. It has to be activated.
Other questions in the last few minutes? It looks like we're good, Tom. Thank you for hanging in there, you guys.
Goodness, that was right on time. That's wonderful. Thank you, guys. Look forward to talking again soon.
All right. Bye, Tom.
Bye-bye.
All right, I gotta go to the meeting.